of this impact on the victims. So in this program, we'll be walking our listeners through the various ways FGM impacts the life of its victims. So just one sec, okay, great. Now, okay. So, yeah. So to help us actually make sense of all of this, today we have two guests with me in this call. I have Dr. Heleen Margriet Koudijs. I'm not sure if that's the correct pronunciation.
Very good.
Yeah. Who is a senior advisor, project lead, and medical doctor of global health and tropical medicine,
Medicine.
something,
Yeah.
at Pharos.
Correct.
You're going to tell us a bit more about Pharos, so we hardly know what Pharos does. I'm quite ignorant about that. And then we also have in the call our Miss Aminata Bah, who is a social worker and an FGM health advocate working with the NHS in the UK. She's also an ambassador with the End FGM EU network, while she is also supporting other NGOs to end violence against women and girls. So on this note, I would like to welcome you, ladies. Thank you
Thank
so
you
much.
very much.
Yeah.
Thank you for having us. Thank you.
Perhaps you might want to share a few things about yourself, a few details with our viewers and listeners that maybe I didn't mention. Please feel free to do so before we proceed.
Shall I go first?
Yeah, you go first.
Okay, perfect. So my name is Heleen. I'm indeed working for Pharos, but I'm a medical doctor, and I worked quite extensively from 2018 to 2022 in first Ethiopia and then Sierra Leone.
Yeah.
Mostly in projects also related to women's health.
Yeah.
So that's actually how I got acquainted with the topic, which is very close to my heart, and that's also how I moved to Pharos.
Wow.
I don't know if this is the time to say something about Pharos.
Yes, please.
Yeah, okay, I will. So, Pharos is the Dutch National Expertise Center on Health Equity, which sounds very difficult, but we basically focus on unnecessary and unfair differences in health or health disparities for specific groups.
Yeah.
Meaning we focus on making healthcare accessible basically for everyone, whether you're born in the Netherlands or whether you're a migrant, whether you are highly educated or hardly educated, everyone should have the same access to healthcare and also the same outcome.
Okay.
And related to FGM, we are the national focal point for FGM, which means that we do a lot of advice and also connecting different stakeholders, healthcare providers, so that women who survived FGM are getting the care they need in the Netherlands.
Right. How does your work, compare with what the KK does, or is there an overlap?
Who does?
How does your work compare with or overlap with KKD?
GGD. Oh yeah, so GGD has, which is basically the public health service in the Netherlands. So they have a very important role in public health services, meaning they also offer, like for instance, care for women who have undergone FGM. So they sort of link them too. But it's very much from an health promotion perspective, whereas Pharos is sort of taking the helicopter view and connecting all the dots. But because we also have medical expertise in-house, we can also sometimes give specific advice to healthcare providers who are not used to seeing women or helping women who have undergone FGM.
Yeah. Okay, awesome. Thank you so very much. All right, Miss Aminata, you may go next. You can tell us a bit more about yourself if you wish, if you so wish.
Yeah, thank you so much for having us today. So my name is Aminata, as you said. I'm joining you from London, UK today. I am a social worker, children and family social worker. I'm no longer working for the NHS as a health advocate, but I was working with them for the past 2 years, maybe and more, within one of the clinics that support women who have undergone the practice of FGM. Also, in addition to being a senior ambassador to the End FGM EU, I'm also one of the co-president, a board member of the network.
Yeah.
Yeah, so the issue of FGM is dear to my heart. I come from a country, I think we are the second, which is Guinea-Conakry in terms of prevalence after Somalia. And yeah, I'm pleased to be here today. Thank you.
Awesome. I do hope that after this, the two of you will connect. You never know, you might do something together.
Yeah, I think we already through the network, isn't it? Pharos is part of the NFGM EU network.
Yeah,
Definitely.
awesome. Okay, so let's just get started. So like I probably hinted you, it appears that there isn't much research available regarding the psychological, social, and the social, let's say, impact of FGM, which kind of surprised me when I was trying to do a little research on that. I don't know whether you agree or not. I don't know what your take will be on that position. Yeah, so maybe Aminata want to go first.
Yeah, it's not, to me, really, it's not surprising. It makes me smile because when you come to FGM in general, this is topic, it have been said again and again, is really under-researched. And one of the campaigns, one of the advocacy that goes around with organization working in the area is that we need more data, we need more research, we need really that work to be done. And I've seen, I think there was this agenda with the joint project, UNICEF and UNFPA. I think they're coming together. It was, I think, last year, where they have this agenda draft to encourage research in the area. So it's a good news, but it's not a surprise. I did my, on a personal level, really, my two dissertation, my first degree and my master's one was on FGM, two different focus area, but it was very, very difficult to find,
Material.
material, peer-reviewed articles.
Yeah.
There are some in the medical side, I would say, that talk about the health impact or the physical health impact of FGM, what is FGM, the different type, etc. But anything to do with the psychological, the mental health, for instance, the research on mental health and FGM is quite limited. And even the impact on, I would say, the different programs, the organization working around FGM, the lived experience of women and families or communities,
yes,
all that is quite limited. So it's not surprising. Yeah, but in terms of the reasons really why this is what it is, it can be many, really. Maybe lack of interest, I would say.
Yeah.
In terms of fund, in terms of decision makers as well, who fund research projects in this area. Maybe ethical issues as well, to conduct some good research in the area. You know, I'll let Elaine add some few words if she wished to.
No, I think I have to agree with everything you said. I think it's a very difficult topic to research. And I think in general, it already starts with that there is a problem with what we call prevalence research, which is basically how often does it happen and how many women does it affect in the Netherlands, where I'm from now, or in Europe in general. So these studies on numbers, so purely numbers, they have been done. But there's always a big uncertainty in them because, I mean, part of it is done based on scientific calculations rather than actually seeing all these women. And I think that is also related to some issues with this topic. So like you said, it's felt as a bit of a niche here, which I don't think is necessarily fair, but because it doesn't affect a huge group like in Sierra Leone, where I worked, or Guinea-Conakry, where you're from, like it affects so many women. Here it's seen as a minority group already in general that is affected by it, which is one. Then, of course, there is shyness to address the topic. And I think that comes both from providers as well as from patients. So there's really a mismatch also in people wanting to address it. And I think, I mean, people are also just not really linking yet, because there's a lack of knowledge also among healthcare providers. If I look at my own training, that people also don't really associate certain aspects, for instance, to the practice of FGM, which makes it even harder. So I think the fact that we don't really know who all the affected population is, together with shyness to act, not a hot topic, so you want to say, for funders, researchers, etc., plus lack of knowledge together makes it quite difficult to get evidence. And it also affects us in our work at Pharos, because we always would like to give, like evidence-based advice if possible. But a lot of the evidence is actually very low. They call it low-level quality, just because it hasn't been studied extensively enough.
Do you think this situation is going to remain as is, or it's likely to change? Because if there is a need, every now and then there's a need for this kind of information, but the data is not there. You think there's going to be attention focused on this at some point in time?
Well, I think, that's definitely what NFGM Europe is focusing on a lot. It's also what we are at Pharos are doing. But that's also, for instance, why we are spending a lot of time trying to get education about FGM and other harmful traditional practices in training programs for medical professionals, etc., trying to raise awareness among the women affected. So to sort of, get it on the agenda, but it's definitely a process. It has proven not to be super easy. Otherwise it would have been solved
by now. Yeah. Okay, we'll just keep our fingers crossed and going forward, hoping that it will get to where it must get to. So then, based on your years of work and experience on FGM, would you like to share? I think you shared your perspective on generally on this, but I would like us to maybe take those 3 areas and kind of deep dive a little bit. Okay. So let's talk about the psychological consequences of FGM based on your practice, your experience, encounter with people. Can you maybe mention some of the psychological consequences or impact that you have noticed on people? I think that would be nice to share with our viewers and listeners, because some people have totally no idea. And when you mention FGM, because it's a taboo topic, so some people are kind of shocked sometimes when you raise the issue, but they need to know what it is and what is really happening, so they can be able to empathize more.
Yeah, no, definitely.
Yeah,
yes.
So go ahead.
So
take your time.
Oh, sorry. No, so in terms of psychological effects, I think what I've heard more than have frequently are, for instance, people having fear or anxiety disorder, depression related to FGM. Also, of course, some women can experience post-traumatic stress syndrome, or having reliving moments where they rethink about what happened in the past. And I told you a lot of my work also before, but also now at Pharos is focused on women's health. So the negative consequences on sexuality, but also related to sexual reproductive health issues such as delivery. Delivery itself can be very traumatic for women who have undergone FGM, because things are happening in that area, which is already so sensitive for women, let alone if you survived the practice of FGM.
Yes. Yeah. Aminata, you want to just ask some?
Yeah, I think really Heleen has touched everything in that area, really. And it's important to really emphasize the psychological impact, because they are as severe as the physical impact as well. And are you struggling to hear me? Sorry.
And now we can hear you. We can hear you. Yeah.
Okay. Okay. So I was saying the psychological impact are as severe as the physical, impact as well. So it's really important to talk about it. Women affected by FGM, I think what I have seen in my work and in my personal experience is that burden of not even being able to talk about it, having that psychological, burden and that mental health buried inside you for years and years, and not being able to share with anyone, because it's not recognized and it's not understood. It's something very, 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 very powerful. And for women who've been to the clinic where I was working to seek counseling, most of it, like Dr. Heleen said, is linked to that sexuological consequences, like the problem they are encountering in their relationship, in intimacy, that developing, the anxiety of being alone with a man, the depression with that, the fear of being touched, so it's quite important to consider all these things, but also to consider, I think, the journey of the survivors, the women, because everyone will experience their own psychological impact differently at different stages in their lives, So yeah, that's important to recognize.
Yeah. So, Elaine, yeah, how do you give us a scenario of how you try to help people who have been impacted psychologically by this experience, how to kind of bring some relief or some sort of healing to people who have this kind of had this kind of experience? How do you take care of them?
Well, I mean, first of all, let me say I'm not a psychologist or a psychiatrist. I wish I also was, but there's a lot that I can leave to other professionals. But I think it really starts with, like as a healthcare provider, being aware that these effects occur because of FGM. And also like acknowledging it and being open, and also sometimes when you see that women are affected, to sort of break the taboo a little bit. So if I'm able to talk about it and step over that shyness, and talk openly and give women space also to ventilate their thoughts, because like Aminata say, they can be different at different stages of their life, and also in different situations. I think that by itself, we see a lot, I recognize a lot that women feel relieved when they feel acknowledged, and also, how do you say it? Accepted in a way, and also that they feel accepted that this is actually true. I think that is very important, whether you're a medical doctor, a social worker, or wherever you work, to sort of, acknowledge and give space, and give them literally the physical space to address how they feel.
Yes. But have you like come across women, and this is to both of you, have you come across women who are in this phase of their lives and struggling really to come to terms with what has happened to them and to still get on with their lives? Have you come across a number of women who are dealing with this phase of their lives, having experienced FGM?
Yeah, definitely. For instance, I'm 32 myself, so women in my age category are often busy with babies and thinking about how they see their lives, for instance, not only as a partner or as a wife, but also as a mother. So I've seen cases also where women are really, like also struggling with the fact and also the fear of having undergone FGM and then having to get pregnant, or like also child delivery, and what that could mean, not only like Aminata said, physically, but also for their mental health and well-being, and whether they feel they are capable, if they are in a well enough mental state to deal with that, because it affects so much also their fear and how they look at basically very human things like relationships, pregnancy, and becoming a mother.
Wow.
Yeah. I would like to add to that, really. I have encountered many young women who are at the age of getting married, and who has undergone the type 3 of FGM. So they come and seek counseling, and then therapy first, and then they go through the surgery before the wedding and all that. So it's quite a journey, and it's quite a difficult period of time. So most of them are in their 20s, or late teenage years, and they are starting the process, to getting ready for the big day. So it's humbling. I would say for me, it was really humbling to work alongside these women, to accompany them in that journey. But it's also really gets to me, it saddens me, when I see this and when I know that all the burden, the fears, the anxiety they are carrying for their big day, which is supposed to be a happy moment, a happy day, but they are this, all that it's covered, I would say, replaced by anxiety and fear and etc. So it's really, FGM is a silent, I would say, killer. I think I would say it because we don't imagine, we don't realize how much survivors, women affected by this practice suffers. But I have also encountered partners really, which is that come to the clinic to support their wife, that make the call for them, booking the appointment, which is also very positive to see.
Right.
So yeah, I think that's a hope, is a positive thing that we should capitalize on and work on, and continue to raise the awareness really, and join the forces to end this practice.
Yeah, from both of you, you come from Guinea and you were in Sierra Leone. Okay, how well is the campaign to stop these harmful practices? How well is it being received, and can we see? Can we really see the practice, like, uh, diminishing? Is it getting down to the grassroots? What would you say about that?
I think for me, I really struggled. So I have Ethiopia as an example, and then I worked in Sierra Leone.
Yeah.
And in Sierra Leone, there is no law against FGM, which I found so difficult to understand and to deal with. But that didn't mean that I didn't see improvements. Like, for instance, I worked in a hospital. I had a lot of staff, educated women. None of them had their their daughters undergo FGM. So there was definitely a lot happening there. They are all aware. They're all against it. They're also much more open and vocal about that. They also want the practice to end.
Yeah.
But then we did a lot of outreach to rural communities, and if you're really in a rural community, like, social norms and tend to be a lot more important than what is happening in the bigger world. So also like young patients, but also in our delivery room, I still saw a very, very, very high number of women being affected. So I think, like, concluding, like, in the sort of the urbanizing community and the women that are getting education, you see that there is a big change happening. I think also Nice Lengete, the Kenyan advocate, has spoken about the importance of education also to end FGM as a practice. But I think, like, if you're in rural communities in some African countries, then still, like, social norms also still keep it intact, the practice, unfortunately.
Yeah.
Yeah. What
I
about?
totally agree.
Yes.
I think in Guinea, Conakry, it's looked like the same really. In the capital, which is Conakry, we have a lot of active, I would say, young people really campaigning, going around in social media and doing a powerful, really, job, about raising awareness, but also stopping the practice. But when you go down in villages, I would say in rural, communities, it's the story is different, unfortunately. But there have been change, I would say, in Guinea. And once again, in terms of data collection and research, we are behind. We still come up on the global map as the second with, I think, 90 something percent, but that has gone down, or 80 something percent in terms of prevalence. but that has gone down. There are some like local organization, but also international NGOs that recognize that there have been changes. Changes happening, but it's slow, you know, because we have the other issue now that some families as well who doesn't want to engage in FGM, but because it's so strong and rooted within the society, they don't want to do it openly. So they will not come and say, okay, I'm not doing it anymore.
Yeah.
Still, maybe there can be ceremonies in families, but older girls are not undergoing the practice anymore. So here again, another challenge in terms of research and collecting data. So yeah.
Right.
That's what is happening in Guinea, apparently. Yeah.
Okay, awesome. Well, let's touch on the social consequences of for those who have undergone the social impact. You might say for those who have undergone the practice, it might be related to the psychological as we've spoken, but perhaps as we try to deep dive, we might perhaps highlight more the social impact of FGM on those who have on the victims. Can we look at that? And any of you can go first. Yeah.
Yeah. It's interesting because when you are within a country, for instance, or growing up within a country or a community which is practicing FGM, I would say the social impact can be quite positive for you because you are part of that circle, I would say, where you feel like you are privileged, you have now a sense of you have this sense of belonging of the community. Within
Is
the
it like
community.
part of like a rite of passage that is done?
Exactly.
So
Yeah.
once you've done it, then you've come of age, sort of
There
something
you
like that.
go. Yeah. So you are respected, you are considered more of a woman. So, once again, it may depend and differentiate between depending on the communities or in different parts of the world. But definitely for Guinea, you have that identity now that is established. You have that sense of respect and belonging.
Yeah.
So, but in contrast, when I look at in the European context, for instance, if if you are from a practicing community in Europe, you are a part of the minority, and you can feel really, really different, and ask yourself, why is this happening to me? I don't understand. And you can feel isolated, and if you decide by chance, if you decide that you want to fight against the practice, you can be ostracized and you can be rejected as well from your own community. And then, there's this racism, stigma, stereotypes that comes with it as well. You become othered because you are different. You come in with your different practices and tradition within communities that are completely have different rules, different norms, etc., etc. Yeah, so the cost can be quite high, I would say, depending on where the context where we are,
So, like within a social setting, how would other women recognize or identify another who has undergone FGM? I mean, and to the extent that socially they can be impacted, excluded or discriminated against or something like that. How would they know that a fellow woman has undergone FGM?
That's interesting. It's assumed that everyone from my community is assumed that they're gonna undergo FGM, So like I was saying, so because of that, even if your family decide now they are a bit progressive, they're not carrying those conservative ideas anymore. They have to hide it. They cannot openly and say, we're not practicing FGM anymore. And we still have that issue, that challenge, So today, there are families in Guinea who are not practicing FGM, but they're not going to say it openly. assumed, and when it happens as well, is a ceremony, so everyone knows in the area, so it's not done quietly. Now it will be done quietly because there is a law. People are trying to hide from it. They
Yeah.
can do it at a younger age, but in certain communities in Guinea, for instance, it's done openly. During holidays, you see young girls walking the roads, although there is a law, the way they are dressed,
Yeah.
the way they carry themselves, you know that they are in that moment where they are going through the practice,
Really.
the ceremonies and all that. So it's done openly, I would say.
Wow, it's
Yeah.
a deeply rooted cultural belief that it's hard to kill. I should say.
Okay. Mm.
And I
Yeah, I
think
know.
it's very much dependent on the social norms, like Aminata said. Like
Yeah,
it really depends on the social norms of the context you're in, basically, how you're received and also how you perceive yourself, basically. Yeah.
yeah. Yeah, I know some of the culture, traditions, beliefs, norms. Some of these things they don't die easily. I mean, we carry them for generations, and it can be a problem. Yeah.
Yeah.
Oh,
And I think it's really like what Aminata said, like it really depends also who is your peer group then. So
yeah,
who do you relate to? Like, for instance, we hear from women in the Netherlands that decide to opt out sort of so that they themselves or their children, their daughters do not undergo FGM. They can feel protected because of the Dutch general context where FGM is seen as child abuse, which it
yeah,
is. But if they look at the specific context of, for instance, a Somalian community in the Netherlands, you can still feel very much you might be risking being an outcast or being rejected or sent off from your community. So you also really see women struggling with that.
yes,
And one lady has to be the first one, but we also have a lot of key persons, sort of survivors that we work with at Pharos who say, like, if they are the first one, it's so hard. Like, it has such big, dire consequences for them also to sort of say, I don't want this practice anymore. And then it only becomes easier when more women sort of also say they opt out, because then there comes a new community forms with new norms forms where you feel safe in. But like rejecting what the community around you feels is really, really difficult.
yes. So for, I mean, so for those Guineans or Somalians and the rest that are living in the West, I mean, are they? I mean, I'm sure they do have some kind of modified version of the rites of passage uh, for the young girls. And I want to presume that they don't. FGM is not included in that. Do they have some sort of activities to celebrate the passage of the young girls into adulthood? Still, how is it now? I just want us to have an idea.
Mm. I mean, you mean here
Yeah, here,
in
yeah, in the
Central?
West, yes, yeah,
No, nothing I'm aware of. I know at least nothing that is generalized, I would say, within the community, which is there. But I know that there are some families now, they go out to celebrate period time, for instance, puberty,
yeah. Okay,
both for boys, but also for girls, and they have also some like working groups or clubs for the girls, for young girls, where they talk about the culture, what is good about our culture, what is bad about, I mean, less good about it, I would say.
yeah,
But nothing really that stand out, I would say, as FGM that is followed by everyone.
okay,
I've seen, I think, in outside Europe, in countries where the prevalence is high,
yeah,
they're trying to replace it. They're trying to replace the cutting by, do the ceremony, but don't do the cutting,
the
for
cutting.
instance.
Okay,
Trying to
yeah,
encourage that, and there are some communities in West Africa who are taking part into that, you know.
Yeah.
But not in
I
the
think that's
Western
more
world.
progressive to look to reform the the ceremony so that they take out the harmful part of it. You know what I'm saying? Yeah,
Yeah.
there's a sense and a meaning to having these kind of ceremonies where a child passes from puberty into adulthood or what have you, and
Mm.
then so it's nice to maintain that, but to take away the harmful part of it, I think that hopefully the transformation is completely is done for the different cultures we have. Yeah. Okay, awesome. Let's now deep dive into the sexual impact. Now we know already that there are difficulties and complications associated with the FGM when it comes to the sexual terrain. Yeah, it's maybe we mentioned some of those during the discussion of the psychological part of it. But maybe you can perhaps throw more light, if you wish, on the sexual impact of FGM on the lives of these women. Maybe you can. I think it would be nice to do some get some more detailed insight into how it impacts their lives.
Yeah. So I think Aminata already mentioned a very important topic, which is related to basically sort of the physical aspect
Yeah.
of sex. So for
Yeah.
women who have undergone a type 3, which is the type where sort of the labia of a woman are sewn together. So there's a
Yeah.
very small opening for urine, and
Yeah.
there it's often not physically possible to have
Have
very
intercourse. Yeah.
yeah, exactly. Which makes that part very difficult. But then how sexuality is perceived is also something entirely different, which relates to a lot more factors. So of course there's a lot of research that says that, and also I've heard it a lot that women say, like, I have pain all the time, like I cannot have sex without having pain, even if my husband is very nice to me, even if we like we take the time, it's still always painful.
Yeah.
But there is also women, sex means a lot of things to a lot of different people. So there's also women who say has something different. There's women who do get orgasms, there's women who do have pleasure in sex. It's a very wide spectrum, basically, of how FGM affects
Experience it.
you.
Yeah.
But I think, like, even more than FGM itself is already a taboo. Sex and FGM is a ginormous taboo, which makes it also really difficult for a lot of people to talk about it. And I think it's such a shame, because there's also a lot to be won here.
Yes. Absolutely. Yeah. Aminata, what would be your take on
Yeah, I think she's on point, and I think it's the same really. Most of women who I have encountered at the clinic come in because of lack of desire or lack of pleasure
yes.
during intercourse. There is a term for it in medical. I can't remember. I start with G. I've
Spurious.
heard- There you
Yeah.
go. So yeah, it's not a laughable matter, but it's really it's really difficult because that's part of the daily lives, and being married and having, or being with a man, having a partner, and you cannot live your sexuality at the fullest is really it's
It's really
difficult.
tragic. Yeah. Very
Yeah,
tragic.
it's tragic. So this is most of the women here have encountered is that, and like I think Dr. Helen said, is really depending on the FGM you had, the type of FGM you had, you will have different consequences, and it
Yeah.
will affect you differently.
Mhm.
But yeah, sexually, I think this is the main reason FGM is taking place, is really to affect that particular really sensitivity of the woman and all that. So
Yeah.
most of women will a good number, I would say, of women will have some consequences around that, where there has no feeling, no desire, and you can imagine what does that mean really in their lives. Yeah.
Yeah, and I think also, like you say, it really affects also being a woman a lot, which is what I hear a lot. I also heard it from friends in Sierra Leone who had undergone the tradition themselves, that they also said, like that they really felt, which I think is so, so sad. Like they felt
Yeah.
that they were less of a woman
Woman.
because of specifically this aspect. And I disagree wholeheartedly, but talking to them, you see where they're coming from, because it's so, yeah. It's very sad.
It is.
Yes, 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 yes. Yeah, I just wish I could give back to those women whatever they took away from them. But there is along the line, we met a doctor, a surgeon here was then in Amstelveen, and he had a practice where we had he did what is called a reconstruction. I don't know from a medical point of view, Dr. Heleen, I don't know if you can tell us how effective, how reassuring, how comforting that sort of procedure can be for women who have been who've had, let's say, type 3, for example, type 3 FGM, and they want to undergo reconstruction. I mean, to what extent does it restore their confidence, their dignity, their sense of well-being, and all that?
Yeah, so I think first of all, it's important to mention, of course, that what has been taken away is not something you can replace. But of course, like in terms of sensitive tissue around the women's private parts, there is a lot still there also after FGM. So
Yeah.
when they're doing reconstructive surgery, they're basically removing a lot of the scar tissue, sensitive tissue more to the surface, so that women can have then women can their private parts look more like they would have before the practice, etc. So in the Netherlands, it's currently, there's some different rules and regulations in Europe. In some countries, this is already done like for different indications.
Mhm.
In the Netherlands, currently, it's mostly done for people who have physical complaints, but not so much for psychological or sexual consequences. But they're researching whether it could also be done for people who experience sexual problems or psychological problems after FGM. I think it is for a group of women, it can be potentially very helpful, if only because they feel they are like getting some form of rehabilitation.
Yes.
But I think for another group of women, like also having a sexuologist who is culturally sensitive and used to working with women who have undergone this practice can also be a good solution. Or having a good psychotherapist to talk about their fears or their trauma or their depression that came from this. So I think it's very women specific and women dependent, whether a reconstructive surgery or a sexuologist consultation or a psychologist or maybe physiotherapist consultation is the best solution. So I think it all comes down to basically patient-centered and case-specific care.
Yeah. Well, they say half a loaf or half a bread is better than nothing. So if there is something like that that can at least help towards the healing or restoration, I think it's better than nothing at all.
Yeah,
So
no,
that,
yeah.
that is some good news, I would say.
I think
Yeah.
women having sorry to bump in,
Yeah.
having that choice, that service
Yeah.
available for women, and they can choose to use it
Yeah.
or not. I think that must be,
Yeah.
encouraged. That should be there.
Definitely. Definitely.
Yeah. Is that something that either of you ladies have come across in the line of your work, which maybe touch you so deeply about any of these three areas we've spoken about, the psychological, the social, and the sexual? Maybe a recollection of something you have experienced or seen or heard will maybe touch you deeply on this topic you want to share. Yeah, so feel free if there's along the course of your work or you experienced something or heard something that maybe touch you deeply, you want to share.
It's difficult,
Yeah.
Larry, what you're asking, because I
Mm.
think everything is touching and emotional in this work. I
Absolutely.
mean, you know, there was no moment that I go to that clinic or I go into this family or I do a workshop where I don't feel like, okay, maybe I've taken part of someone or I've left part of me there, there have been moments where you you cry internally with the
Yes.
women that you see, and just remembering like women coming in, I would say everything, yeah, every moment is difficult, I would say it touches you. But seeing women coming and seeking support, that's very, very courageous and brave of them. But seeing them desperately seeking
Yeah.
for reparation, and wanting that piece of them that was taken years ago to come back, that's difficult. That's really difficult, especially when and in the UK context, for instance, we the NHS, the National Healthcare System, doesn't provide surgery for women
Oh.
who has like reconstructive surgery. They do surgery for women who have undergone the type 3 FGM. That's the amputation is called.
Yeah.
But for reparation, they don't do surgery like that. So having to interview and receive women who are seeking specifically that reparation, and then they have to be turned down, and looking at their face, that's something that stays with you, you know. So yeah, that's what is coming to my mind. But there's more really. Every soul, every woman you meet in this line of job, you remember them.
Yeah.
I have two cases, I think, that really inspired me to work more on this topic. So the first one was when I was training as a doctor for my specialization program, and I was working in the delivery rooms. And there was a girl, very young, from Eritrea, and she had undergone a type 3 FGM, and she was terrified for delivery. She had
Wow.
probably been raped, and she came to deliver, and she had been so she had undergone type 3 FGM. She was in the delivery room, and it was she was terrified, but all the healthcare providers were in that room sort of looking at her like she was some sort of, like having a look at her private parts. I think there were 10 women between her legs, like had been between their legs looking at her like she was some sort of bizarre creature, not communicating with her. And I thought, oh my God, we have to do this better. How is this possible?
Yeah.
This is a few years ago, but it really inspired me that, I think we need to train also our healthcare providers and our health team, because this is not right. Like, women deserve good care.
Yeah.
And you shouldn't be feeling like as an outcast in that setting. Like,
Yeah.
you should be getting culturally appropriate care by people who care about you. And it really, for me, it inspired me to work further on this topic. So that was one. And then there was one experience in Sierra Leone where I had, so this was in the Netherlands, of course. Then in Sierra Leone, I had a really nice medical doctor from Sierra Leone who was under me, who worked in the delivery rooms there. And she called me at some point and she told me, Heleen, you have to come to the hospital. So I asked, what's going on? Her name is Asanatu. And I said, so I went there and she said, Heleen, I saw a woman with a clitoris. She has not been cut. Imagine she has not been cut. But she was so
Wow.
happy to see an uncut woman.
Okay,
But
happy.
she
All
was
right.
also so sad for herself. She said, because she's like, oh, how I wished I was that girl, and how amazing. So she was complimenting the family and asking, where are you from? How does it work? How amazing that she is, like already adult age. She's not been cut, so they talked about it. But
Well, viewers, we have been busy with this topic, and I'm sure you have learned a lot from these two ladies. And we would hopefully we would have them back some other time, hopefully on a related topic or something. But we certainly have enjoyed you both, and I want to thank you so much for your time. And we'll keep you posted on what happens from here on. So thank you so very much, and I want to wish you a lovely evening.
you too. Thank you so much.
Thank you.